Hi everyone, welcome back. So I'm going to do another video on shoulder injury. This time I am going to be looking at slap tears. Now the shoulder is a very complex joint. Most people think it's just one joint. It actually consists of about 5 joints. The main one being, of course, the glenohumeral joint, or the ball and socket, which forms the main sort of, joint in the shoulder that we all know of. And that's made up of 3 bones. So we'll just have a quick look now at the anatomy that we're going to be talking about. So that main, as we say, ball and socket joint here is made up of 3 bones. So you've got the humerus, which is that upper arm bone that forms the ball of the joint. And you've also got the shoulder blade, which sits around the back. And also the clavicle, or the collarbone, which comes across the front there. And all 3 of those meet at this ball and socket joint. Now, the head of the arm bone articulates with the glenoid cavity, which basically is the socket part of the joint there, around which is a strong fibrous tissue called the labrum. And that in this diagram is that red part there that surrounds that glenoid cavity. And the labrum basically helps to cushion and deepen the socket, therefore stabilising the shoulder joint. Now, you've also got a lot of ligaments and the biceps muscle tendon, so the biceps being in the upper arm. The tendon of that muscle actually attaches to the top of this labrum that surrounds the glenoid cavity, or the socket of that joint. And that attachment there also helps to provide shoulder stability alongside those rotator cuff muscles that sit around the shoulder blade. Now, there are various types of labral tears, but a slap tear, which we're talking about, so that basically stands for superior anterior to posterior, superior labral, anterior to posterior. So that basically means that the labrum is tearing around the top of the labrum, where we saw in that diagram that the biceps tendon attaches, and it tears, from the front to the back. So it's sort of on the top part of that socket. And this usually will occur over a period of time rather than being a sudden acute injury. Now, as I've said, there are various types of slap tears. So we're going to talk through the different types now. So in a type 1 slap tear, you're going to see fraying of the top rim of the labrum, which is still attached to the glenoid cavity and to the biceps tendon here. This is common in middle-aged or older patients and is really usually due to the aging process. And this is a relatively mild slap tear and can be treated without surgery. Then we have a type 2 slap tear, which is the most common type of slap tear, where the labrum and the biceps tendon detach from the top of the glenoid cavity here. And you can see it's just detached and come away. Now this can be further identified as anterior, posterior, or a combination. And usually with this type of slap tear, it does involve an arthroscopic or keyhole surgery just to repair it. Now our type 3 slap tear is referred to as a bucket handle tear. And you can probably see why from this diagram. So the torn labrum can drop into the shoulder joint, and the biceps tendon here remains intact. And usually, again, this will require arthroscopic surgery to fix that kind of handle appearance of the labrum and to basically lift it back up. So then we have a type 4 slap tear. So this is your bucket handle tear to the top of the labrum, just as we've just seen in a type 3, but the tear extends this time into the biceps tendon. Now this is the least common type of slap tear. Then you've got a type 5 slap tear, which is known as a Bankart lesion. Now this usually happens due to shoulder dislocation. Now I'm going to be doing a post on shoulder dislocation. That will probably be the next one that I put up. So if you want to watch that, do subscribe to my channel. You'll be informed when it comes out. So a Bankart lesion, or type 5, is basically like a type 2 slap tear, where just the top of that labrum detaches from the glenoid cavity or the socket, but it extends, sort of superiorly. Across the top part of the shoulder. You've got a type 6, which is basically an unstable labral flap tear, which does also involve biceps tendon separation. And then you've got a type 7, which is a superior labrum and biceps tendon separation that extends anteriorly, so down the front. Now, there are some risk factors that make you more prone to developing a slap tear. Certainly, probably the biggest one is anything where you're performing repetitive overhead movements. So sports like baseball, swimming, weightlifting are all going to sort of carry a bigger risk of developing a slap tear. And because of this overuse, these repetitive movements, the labrum basically just gradually wears down and therefore becomes prone to injury. Aging is another one, more common definitely in people over 40, again due to wear and tear, and the labrum being less firmly attached to the glenoid cavity. Research has also shown that sports injury is the leading cause of slap tears, and we mentioned just briefly there about dislocation, so that's certainly one of those injuries. 50% of slap tears occur in those over 40 years old, usually in people who have signs of instability there in the shoulder from previous trauma or repetitive injury. Maybe, they've fallen on an outstretched arm or an injury from heavy lifting. So that could even be like an occupational injury. Most of these are type 2 slap tears. That is the most common type. Now, type 2 slap lesions in patients under 40 are usually linked to a Bankart lesion. Now, causes of slap tears. We've mentioned there about overuse, these repetitive overhead movements, which can be occupational, but also people like weightlifters, swimmers, baseball players, any athletes in sort of throwing sports, so javelin, discus, shot put. Anything that involves hyperextension of the arm is going to, produce a greater impact through that shoulder. Also injury. So we've mentioned about falling onto an outstretched arm. So, even sort of footballers, could be prone to this. shoulder dislocation, car accidents, or anything where there is a forceful pulling on the arm. So maybe, you know, if you sort of go to catch a heavy item, you know, or where there's rapid forced movement of the arm overhead. So again, sort of thinking to our throwing athletes, that would be quite applicable. Another cause we've mentioned, wear and tear in the over 40s or older, you know, clients. Bursitis, which is inflammation of those fluid sacs that cushion the joint, and rotator cuff tears are also often connected to slap tears. And when you think the rotator cuff muscles, they stabilize the shoulder joint. So if they're torn and weak, that whole shoulder is going to sort of become less stable and therefore, again, more prone to injury. Now, if we look at the symptoms of a slap tear, one of the most obvious is that there will be a locking of the shoulder joint or a grinding or clicking sensation and a feeling just of general weakness and that the shoulder's going to give way. There will also be a sort of a deep aching sensation, you know, with any kind of movement or lifting overhead. And, you know, the pain can be intermittent and difficult to pinpoint the exact location. It may be felt around the front of the shoulder if the biceps tendon, which is right at the top there, is affected. There may also be pain if you hold the shoulder in a certain position. So for example, if you're stretching the arm behind the head and you're just sort of sitting back like that, you may find, you know, that you then get pain. Reduced shoulder strength, certainly, and reduced range of motion, difficulty reaching for things, throwing, you know, and obviously reduced sort of strength and throwing velocity. If you've got a slap tear, you know, it's going to get to a certain point and you're not going to be able to do those throwing movements. But you may find that if you are still able to, that afterwards you're going to get a kind of a dead arm feeling. And just generally there's going to be reduced sports performance, reduced power. You know, if you're a side sleeper, you're going to find it very, very difficult, if not impossible, to actually lie on that side. There'll be decreased functioning of the scapula or the shoulder blade, which often affects those stabilizing muscles, so those rotator cuff muscles. Also the serratus anterior muscles that go down through your ribs, the rhomboids, which are deep on the back, the levator scapulae, which goes up into the neck, and the trapezius, as well as those rotator cuffs. Now, in terms of treatments, obviously treatment's going to vary according to what type of slap tear you have. Certainly there is a non-surgical treatment, and certainly a type 1 slap tear, you know, you don't really require surgery. It's just sort of really a bit of wear and tear. So in this case, you're looking at rest from activities that aggravate the injury, anti-inflammatories such as ibuprofen, just to reduce the pain and swelling. You might want to consider intra-articular corticosteroid injections, but of course, you know, these only last for so long. Physical therapy for maybe 3 to 6 months to restore movement and strengthen the shoulder, which in turn will help to stabilize the shoulder. So this could be in terms of physiotherapy or something like massage therapy. There are also exercises that are recommended to just help to stretch the capsule of the shoulder and to stretch the connective tissue that surrounds that whole joint. and also to strengthen those supporting muscles that we just mentioned. And also, the rotator cuff in particular, also the deltoid around that main bulk of the shoulder, and even the muscles of the torso, which, such as the serratus we mentioned, which also help just to stabilize that shoulder joint. Now, if obviously you have a more severe type of slap tear, then you're going to be looking at a surgical treatment. So this may be suggested, if your pain doesn't improve with those non-surgical methods. And it will really involve an arthroscopy, so it's keyhole surgery. That will be done initially to determine the best course of action. Again, dependent on the type of tear, dependent on the person's age, their activity level, but the surgery may involve removing the torn part of the labrum, or potentially reattaching the torn labrum, or it may involve cutting the biceps tendon attachment. And most certainly you'll be wearing a shoulder sling for probably around a month, after surgery, to just protect the shoulder. And of course, it's important when wearing a sling, to ensure that you start to do a few exercises and just keep some level of activity, to avoid sort of muscle atrophy. And if you've looked at my video on frozen shoulder, I talk about how sort of when you wear a sling for a prolonged period, that can happen and it can bring on frozen shoulder. Now, recovery. Recovery time varies again, dependent on the type of slap tear, dependent on what the surgery involves. And full recovery may take several months, potentially 2 months for the labrum to heal, and 2 more months to, return to, the previous sort of strength of the shoulder. And aside from some gentle exercises to improve flexibility, actual muscle strengthening exercises usually aren't started until around the 4 to 6 week mark after surgery. Return to sports activity really will depend again on the type of slap tear, pain levels, etc. But throwing athletes usually would start to return around 3 to 4 months after surgery, even though full healing usually would take around 6 months. Okay, so first up, I'm going to show you some exercises to help stretch the posterior part of the capsule, so around the back. Now, the most common one that certainly physiotherapists will show you is the sleeper stretch. Now, we did mention that lying on the injured side, if you're a side sleeper, will be really sort of uncomfortable. But this sleeper stretch actually involves you lying on the injured side with your elbow flexed at 90 degrees. And what you're going to do is you're going to use your uninjured arm to gradually lower that elbow down as far as it will go. Now, you're not going to get right down, but you want to aim for probably about a 45-degree angle, and then slowly bring it back up, and obviously then repeat it, I don't know, maybe 10 times or something. And then another common shoulder exercise to really stretch the muscles around the back of the shoulder, so both in terms of the posterior part of the capsule and also around the posterior head of the deltoid muscle on this bulk of the shoulder. So you're literally going to bring the injured arm across your chest and just hold it with the uninjured arm at the elbow to give a good stretch around the back of that shoulder. Now, firstly, we're going to look at exercises for a torn labrum when you've not required surgery. So this is going to be particularly in those type 1 slap tears, potentially some type 2. If surgery isn't required, you want to focus on exercises that increase flexibility, strengthen those rotator cuff muscles that sit around the shoulder blade, and also the other stabilizing muscles that we mentioned earlier that just help stabilize the shoulder joint. So we're going to start off by looking at some wall stretches, that can be done if you've not had surgery. Okay, so you can do this upside down cactus stretch, where you're going to flex the elbow at about 90 degrees with your upper arm against the wall and just kind of turn away from the wall, and that's going to stretch certainly around the front of that shoulder capsule. You've got the overhead shoulder stretch, where you're just going to put your arm against the wall for support and just sort of hold it there to give a good stretch. You've got the overhead tricep stretch, which again is going to really, by just bringing that arm up and then flexing the elbow down to reach down almost onto the opposite side, you're going to be stretching the triceps on the underside of the upper arm and into that shoulder capsule. And then of course we've got the wall down dog. So it's a bit like the yoga pose, the downward dog, but against a wall, where you basically just put your hands on the wall and you're going to bring your bottom back, stretch out, pushing your bottom out and straightening your back and stretching down. And again, that's going to really stretch around that shoulder capsule. Now, other good stretches if you've not had the need for surgical treatment, we've got the double V, where you're going to cross your arms in front of you, place your hands flat on the wall and push in. We've got the lateral reach, again just using the wall for support and reaching over with the injured side to really stretch in that shoulder capsule. We've got the sort of a similar one to the down dog, I suppose. This one actually, you bring the arms together. So the good arm is going to support that injured arm, and you've just got a little added support there. And then of course you've got a sitting pec stretch, which you can do sort of sat down if you need to, but this time hands against the wall, but arms are going to be behind you. And again, that is really going to stretch around the front of that shoulder capsule and into the pectoral muscles. So then we have a stretch for the front of the shoulder. So where you just bring your arms behind you, link your hands and just lift your arms up behind you to really stretch around the front there. And then we've got the hand up the back stretch. So you can sort of hold your hands behind your back and then use your good arm to support underneath the injured arm, and see how far up you can push that hand to provide a stretch again around the shoulder. And of course, the really gentle exercise and a really good starting exercise are these pendulum exercises, where you lean over, you basically drop the injured arm down and you create circles with the arm in both clockwise and anti-clockwise motion. starting off with a diameter of about 1 foot, and then you can sort of slowly make it, you know, a little larger as your shoulder starts to feel stronger. And you can also go forward and back and side to side as well. Now, once you've done those sort of starting exercises, using the wall for support and, you know, just starting with the more gentle exercises, once you're feeling a little bit stronger, you can start to use exercises more to strengthen those shoulder muscles. And a good one, again using a wall, are these wall push-ups. So you literally just stand with your hands out against the wall, bring your feet back, and just push yourself forward into the wall and then back. Now you can also do internal and external rotation exercises using a resistance band. So you can just pop the resistance band around a door handle of a closed door, and then you're literally going to keep your upper arm alongside your body, and you're going to hinge at the elbow. So your internal rotation, you're going to bring the arm in towards your body, and then the external, you're going to bring the arm again, hinging at the elbow, keeping that upper arm into the body. You're going to pull the resistance band away from the body. You can also do an arm reach, so you can lie down on the floor, bring your arms up above you, and then you're literally gonna stretch the arms up, and then you can stretch them slowly back to go towards over your face, just as far as you can without pain. And obviously gradually sort of try to go a little bit further each time, but you've got the support of the good arm there as well. Shoulder blade retractions are also really good for just, you know, getting some movement going in those rotator cuff muscles. So you're literally going to stand or sit with relaxed shoulders, and then you're going to just bring the shoulders back and squeeze them in and downwards, both at the same time. Now, some of the best strengthening exercises when, you know, you have been feeling quite weak and maybe your muscle strength isn't back to sort of near what it was, are isometric exercises, which are basically designed to maintain muscle tone. In an isometric exercise, no motion is allowed. So the motion is resisted and prevented by the good arm or an immovable object such as a wall. So in this first one, which is going to stretch around the front of that deltoid muscle on the sort of bulk of the shoulder there, you're going to stand with your elbow flexed to 90 degrees and held close against the body. And you're going to be standing against the wall, and then you're going to push your fist in to the wall. So the wall is going to provide that resistance there. And you can also work on your internal and external rotation again, lying on your back, elbow flexed to 90 degrees and held close to the body. You're then going to use your good arm to grasp around the wrist of the injured arm. And this is even a good one to do after surgery. And you're going to attempt to move the injured hand outward, resisting motion. So you're going to be providing resistance with the good hand, and you're going to try and push this arm outwards, hinging again at the elbow. You can also do a standing against, you know, a wall or a door frame. Standing again, elbow flexed at 90, held close to the body, And you're going to try for internal rotation to push that hand in against the wall or the door frame. And then to work the extensors, you can again elbow flexed at 90, close to the body, and you can stand against the door frame or wall and try and push that elbow into the wall, and that will work those extensor muscles. Now for the external rotation, again standing, elbow flexed at 90, you're going to attempt to push the hand outward against a door frame or wall. For the internal rotation, again, like with the external one before, you're going to lie on your back, elbow flexed at 90, and again using the good arm to grasp around the wrist, you're going to provide some resistance, and you're going to attempt to hinge at the elbow and move that injured arm inwards towards the body. So those exercises are really intended for if you are relying on exercise alone, if you've not had any surgery done. So what about if you have had to have a surgical procedure? Well, the best exercises to do in that instance, for the first 2 weeks post-surgery, you can do those pendulum exercises that I've just shown you. They are extremely gentle and a really good starting point just to get some movement going in that shoulder. Another good one is to do shoulder shrugs, just shrugging them in an upward movement. Again, you can do that in the first 2 weeks after surgery. Also pinching the shoulder blades backward and together, so like that shoulder retraction one that I showed you, and also isometric internal and external rotation while facing a wall, and just keeping the elbow against your side, and placing the palm against the wall and pushing out into the wall or pushing inwards, and that will work your internal and external rotation. And another one you can do, if you have just like a really soft rubber ball, you can just squeeze the rubber ball and hold for 5 seconds, and that will help some of those surrounding muscles in the arm. Also supine passive arm elevation, so lying on your back, you can hold the injured arm at the wrist with the uninjured hand and just lift the arm upwards and then lower it back down, and just work it up gradually. You don't have to go straight up over your head to start with, just build it up gradually. And also the stretch then, as you get a bit stronger and a bit more flexible, the stretch I showed you earlier, where you use your good arm to bring your injured arm up the back behind you. But as I say, just start with the pendulum ones, build it up gradually, and if you're feeling any pain at all, just kind of stick with what is comfortable, and then you can try again after another day or two. So that's really how to manage a slap tear. Obviously massage can certainly help in terms of helping to reduce scar tissue, which, whether you've had surgery or not, even the injury alone will cause some scar tissue. But yeah, so massage can help with that, obviously, just with the healing process in terms of bringing in more, improving the blood circulation, bringing in more oxygen and nutrients around the joint and into the muscles, in terms of, just strengthening the muscles, keeping them nice and relaxed, and just, maintaining the flexibility there as much as possible. So if you have any questions, feel free to comment down below, or do contact me through my Facebook or Instagram pages, and I will come back to you. Do subscribe to my channel and you'll see lots more posts on my channel, and I will also be doing one on shoulder dislocation. That one will probably be the next one up. So if you subscribe, you'll be notified when that comes out. And yeah, that's really it from me for now. So until next time, take care of yourselves, and I'll see you again. Bye.